Good afternoon, all registered nurses, graduates, or enrolled nurses. My name is Nicole Taylor, and I am a student at ACU. Today I'll be presenting an educational resource on the pathophysiology and related pharmacology for the disease multiple sclerosis. The chosen case study is a 35-year-old female of Irish background with a family history of multiple sclerosis, and she is newly diagnosed with multiple sclerosis. Multiple sclerosis pathophysiology and related pharmacology. The pathophysiology of multiple sclerosis consists of the body's central nervous system and how it is affected through this disease. Biological, genetic, and environmental are all factors in MS pathogenesis. Onset of multiple sclerosis affects the body's immune system. It is an autoimmune attack that results in the progressive loss of the myelin sheath surrounding neuronal axons, which is a protective layer over the nerve fibers. From this occurring, the myelin is destroyed, leading to inflammation of that area, destroying the protective layer. The signals sent along damaged nerves between the brain and the body are also damaged, turning the damaged area into scar tissue. The speed of signal transduction decreases, leading to a loss of function for both cognitive and motor impairment, as well as sensations. Multiple sclerosis progression is known by signs of white matter plaque formation, axonal injury, and demyelination. This then can lead to permanent neurological problems and symptoms consisting of tingling, numbness, fatigue, muscle weakness, difficulty walking, and coordination, affecting one's everyday life. A drug commonly used to manage multiple sclerosis is known as orazapine. The drug class for this medication is immunomodifiers immunology. The class of drug is essential for this patient as immune response modifiers target one's immune system to fight off disease. For this patient, as it is the early diagnosis, it is possible to fight off multiple sclerosis before it attacks any more of the myelin, preventing the attacks from reoccurring. The mechanism of action is that orazapine is a medication that forms into mercaptan and thiamine by enzymes within the body, and once this is active, purine synthesis occurs. Metabolites are incorporated to help to duplicate the DNA and halt division of orazapine. Then metabolites and mediate immunosuppressive and toxic effects. Orazapine is absorbed via the gastrointestinal tract system and does not penetrate the blood-brain barrier. Metabolism then occurs within the liver and excretion through the kidneys, increasing the toxicity in renal failure. Indication for orazapine are imazodol derivative immunosuppressants, immunosuppression in organ transplants, corticosteroids and/or other immunosuppressant agents, procedures that include autoimmune conditions. It is indicated that multiple sclerosis is an autoimmune inflammatory condition. Therefore, the treatment of orazapine is the best practice for this patient. Some relevant considerations to consider before administering orazapine for this patient include the contraindications, which include hypersensitivity, if the patient is pregnant or planning for pregnancy, and if the patient is on contraception, as it is recommended with this medication. If the patient is trying to get pregnant, it is essential to educate that this medication increases the risk of low birth weight, preterm delivery, and spontaneous miscarriage. If the patient is breastfeeding, traces of this medication are known to be present in breast milk. These are essential considerations for this patient as she is female, but it is also important to not only educate her, but also any partners that may be involved with her treatment and management plan. The patient having an unknown TPMT count or a deficient amount of TPMT, as this then leads to a higher risk of myelosuppression. A low amount of bone marrow, resulting in minimal production of blood cells, which can result in infections for the patient. Other contraindications include any known malignancy or any clinically active infections, This patient will be at risk of infection already due to the inflammation at the nerves and the body already fighting the multiple sclerosis, so it is essential to check for infections with a blood and urine test before any procedures as her healthcare professional.